Good afternoon, and welcome to our webinar on delivering high-quality patient care to improve the nation's health, an overview of AMA's resources. My name is Patty Kritzberger, and I'm with the Great Plains Quality Innovation Network. I'm a Health Information Technology Improvement Specialist at Quality Health Associates in North Dakota. The Great Plains QIN is a Quality Innovation Network, quality improvement organization for Kansas, Nebraska, North Dakota, and South Dakota. And our aim is to achieve better health care, improved health, safer care, and lower health care costs. And I'd like to thank you for your participation this afternoon. We're fortunate to have representation from our partners, community members, and stakeholders of all of our 4 states. And so that's really nice to see. Today's webinar will be recorded, and it will be posted to our website, which is www.greatplainsquin.org. But just remember that it's going to take probably 3 to 5 business days to be able to access this recording. And there will be an opportunity for questions after today's presentation, or you can post any questions via the chat function as on the bottom right hand of the screen, because we will be monitoring that through today's session. And so now I'd like to introduce our speakers. First of all, we have Renee Dubois. And Renee currently is working as a Senior Practice Transformation Advisor for the American Medical Association. And she focuses on strategies and initiatives to enhance professional satisfaction and practice sustainability. And she's worked in the healthcare industry for the past 8 years and has extensive experience leading and evaluating quality improvement projects with a wide variety of healthcare leaders using a data-driven approach. And most recently, she trained healthcare professionals throughout the state of Illinois to lead their own quality initiatives by analyzing their data and using evidence-based strategies to create lasting change. And joining Renee today is Ashley Cummings, and she is a project administrator. She has been with the American Medical Association for over 7 years, and in her role as project administrator, Ashley coordinates the planning and development of AMA's professional education offerings for their collaborative agreement with CMS. And so she also manages the monthly engagement webinar series, developing strategies and resources to enhance the educational programs that they offer. And she also serves as the project lead for the day-to-day management of the department's website, increasing the efficiency, effectiveness, and outreach on the website through process improvement initiatives. Ashley earned her BS in Business Management from Hampton University and her MBA in Information Systems from Roosevelt University. And so without further ado, I would like to turn this over to Renee and Ashley. Thank you very much.
Thank you, Patty. So let's first see if we've got perfect. So I'm just going to move through these first few slides to get to ours. So Patty, thank you so much, and thank you to Great Plains for inviting the American Medical Association to speak to you today about the resources that are available to you through the AMA. We have a number of available resources that are all free. They're all free for you and your practice to use, and a number of different engagement opportunities as well. Ashley and I will discuss those more as we move along today. So here's some pictures of us. Here you can see what we look like. We'll go past the slide really quickly. So first, let's start with Steps Forward. To give everyone a little bit of background, we started Steps Forward in 2015 in response to what we saw as a need in the medical community. Many doctors are now saying something to the effect of, I'm no longer a doctor, I'm a typist. And if you think about it, when we're in a courtroom, we don't expect the judge to simultaneously do their professional work, their legal work, and create a legal record of those proceedings. But we have asked that of our doctors. And we're asking for a near verbal recounting of every detail that happened, and that's not humanly possible. You can't both do the work and record the work simultaneously. But in an effort to do that, we're driving both physicians and patients a little bit crazy. Our Vice President, Christine Sinsky, is a national thought leader on the issues of practice transformation and physician burnout. She's traveled the country working with over 50 different physician practices of varying sizes and discovered a number of common themes, both in what we describe as pain points around efficiency, care delivery, and burnout. And she was able to identify some improvement strategies, such as team-based care, that have been proven to increase efficiency, improve job satisfaction, and find joy in medicine. Many of these strategies became some of our first modules on Steps Forward. So what does Steps Forward offer? We currently have 50 modules in a variety of areas, including patient care, workflow, and leading change. 20 of the modules have short but informative videos that you can watch, and all of the modules have free CME, case studies, and downloadable tools that you can customize to fit the workflow in your practice. The case studies within each module are a great place to start. You can read about practices from all over the country that have put some of these interventions into place. Not only do the case studies describe the success that practices have had, but also how they've overcome the barriers they faced along the way. If you're on the Steps Forward website, if you scroll down just a little bit on the main page, you can see that we've grouped the modules into 5 different categories. For example, patient care has modules on team-based immunizations and health coaching, and workflow processes. This category has our module on team-based care, but also has the modules on the subcategories such as daily team huddles, pre-registration process, pre-visit labs, expanded discharge and rooming protocols, and team documentation. On this page, you can also see a link to our practice assessment on the right side. I would recommend that you start with the practice assessment. It is quick, it only asks 12 questions, and takes less than 3 minutes to complete. It will identify the modules specific to your practice's unique needs and will help keep your practice on track and focus on improvement. So let's take a look at a few of the modules. I've selected one of the modules that describes how to implement pre-visit lab testing in your practice. As I've mentioned, pre-visit labs are considered to be one of the processes that you can implement to help your practice move closer to team-based care. This module has Q&A, videos, case studies, and dozens of customizable tools that you can download for free. On this slide, you can see the specific steps that we recommend to implement pre-visit planning in your pre-visit labs in your practice. The steps are more fully described within the module, and I'm not going to get into those now, but this is basically how all of the modules are set up. So you can see the steps and then scroll down and you will see instructions on how to implement it, as well as Q&A, videos, case studies, and the Q&A answering all the common questions and answers that we can provide to you. This one in particular has a calculator embedded into the module where you can calculate the financial impact this could have on your practice. A lot of people find that these are real eye-openers. We have them in 4 or 5 different modules that it really can help you see the financial impact that implementing some of these would have on your practice. In the case studies section, you can read about several practices that have implemented pre-visit labs. A great example comes from Massachusetts General Hospital, where they saw dramatic improvements in time saved for both the physician as well as the care team, and the impact that it had on cost per patient as well. From our module on team huddles, you can read about how the University of California, San Francisco implemented that initiative, and also what measures they use to track success. On the right-hand side of the slide, you can see a snapshot of one of the documents that you can download in this particular module. And again, all of these are free and available for you to use and customize to your needs. Our most recent module is called Creating the Organizational Foundation for Joy in Medicine. This module really gets into the impact that burnout has on physicians and the care team, and ways that this can be improved at a systems level within your practice. From various studies, we know that burnout is a huge issue. A recent national study showed that 46% of physicians show at least one symptom of burnout. And you can see many of the causes shown in this diagram. One thing that we know, and I'm sure you can all agree, is the amount of time spent on documentation and working in the EHR. A recent study showed that for every hour a physician spends with a patient, that same doctor spends 2 hours doing documentation. Another study showed that most physicians take home 1 to 2 hours of work every day, primarily spent on EHR documentation. This equates to 38 hours a month, and when we look at that EHR utilization, we can see that those hours peak on Saturday nights. I think we can all safely say that none of us would like to work on Saturday nights, and our physicians don't either. But for physicians, there's a bit more at risk. Certainly, burned out physicians aren't happy, but we also know that this has an impact on quality of care provided to patients. And the physicians who are burned out tend to make more medical errors and are less engaged in their work, and they're simply more stressed out. In our module on preventing physician burnout, you can take a confidential burnout survey and see your scores and how they relate to national benchmarks. And with that, I'm going to finish by describing what we see as our roadmap to offering implementation support on any of our modules. This support can come in a variety of ways depending on where your practice is right now. For example, and you can see in the assessment and activation box that we offer support to practices who want to implement any of the modules. And that can consist of many different things. It can be as simple as providing some best practices to you over emails, coaching calls, or it can be as involved as hosting a practice transformation boot camp. Another offering that we're about to launch is our digital communities, where you can become part of a cohort of other practices that are implementing the same intervention. This online community is completely dedicated to your specific intervention, and it will be monitored by me as well as one of our physician advisors. This way we can all discuss the intervention, best practices, and you can post any issues or questions that you're having about implementing that module. And the community as well as the AMA can offer help with solutions. And when necessary, we can host coaching calls with myself or one of our physician advisors. We're really excited about launching this digital community, so please let us know if you are interested in participating in that. And so I'm going to end here and take a moment to pause before we move on to Ashley's presentation. Does anyone have any questions for me specifically or about steps forward in general? I'm happy to answer any of those questions right now. You can post them in the chat, or I will be here through the rest of the presentation if you have any questions at the end. So
we have no questions in chat at this time.
Okay. All right, so I would like to introduce Ashley, and she is going to take over from here. And then, like I said, we can take any questions at the end as well.
Thank you, Renee. So as Renee mentioned, I'm going to give a high level of some other areas that the AMA has resources to help you and your team. Renee went through the steps for it, so I'm not gonna touch on that. But the AMA creates pathways for physicians and their practices to choose from a broad array of alternative payment and healthcare delivery models via our educational curriculums. So I'm going to highlight all of our resources that we have around MACWARD QPP, reversing America's opioid epidemic, chronic diseases such as hypertension and diabetes, some tools and resources around our practice management and professional satisfaction. We also, as Renee mentioned, some educational collaboratives we have. And then recently we launched an engagement webinar series this past summer, which we're calling Share, Listen, Speak, Learn. So some of the resources we have around our MAC at QPP, I've included some links in this presentation. So we have a website on our corporate page called Navigating the Payment Process, where you can find tools and resources around our payment model evaluator, our interactive action plan around NIPS. We have the Pick Your Pace resource tool, One Patient, One Measure, we have a podcast series with ReachMD, and then we also are hosting some regional seminars around MACRA, NIPS, and the QPP process. To the right, you'll see a shout-out story that the AMA produced on Clarity on 2017 NIPS working physicians must do. And again, this is a link to the page where you can find all of these resources around MACRA and QPP. The AMA also has an opioid task force where they provide recommendations working on the state and national level to lead the efforts around the opioid epidemic and the tools and resources around. So we have two websites. We have a microsite and a corporate site. And then we also, if some of you are familiar, if not all, with JAMA, and they provide resources as well. We also have some educational opportunities in our AMA Education Center, which you can obtain CME for. Some other things that you'll find on our website are resources and topics on safe storage and disposal of opioids, PDMP, fact sheets, PBS, and certain downloadables, treatment stigma, and the like. Dr. Patrice Harris, who leads the AMA task force, is really heavily involved in leading and reversing America's opioid epidemic here at the AMA. Here at the AMA, we have one of our strategic focus areas that's called Improving Health Outcomes, where they really focus on two chronic conditions such as preventing diabetes, heart disease, and hypertension. These two websites you'll find tools and resources around such as Prevent Diabetes Stat Toolkit, Screen Test and Act Today. They also, when working with the American Heart Association, launched a Target CT resource to help you and your patients. Here at the AMA, we also have in our Health and Science unit, work on cancer prevention, genetics, and personalized medicine. And here you can find resources on all these different topics, precision medicine, working with NIH on All of Us research program, which I have provided a link here. Here at the AMA, we also have various tools and resources around practice management to help enhance your practice efficiency, professional satisfaction, and the delivery of your patient care, such as how to manage your practice, information and tools on Medicare and Medicaid, claims processing, CPT, medical liability, private payer reform, HIPAA compliance, and physician. And we also have a physician payment resource center, which was recently updated. Another area that is within Renee's and our unit is digital health. Digital health is a major focus for the AMA, and this is kind of the landscape that they and framework that they work with. In our health information technology area, here you can learn how advances in digital health technology, medical technology, and health IT are changing the way physicians practice today. As Renee mentioned, Step Forward also focuses on some EHR modules, and our health information technology also has some other resources that can help you in your practice around the digital health, telemedicine, cybersecurity, security risk assessment. The last two, cybersecurity and security risk assessment, we have webinars that you can find on our website, and I'll touch on that a little later when I touch on the webinar series. But we conducted these two webinars, one in November of last year, and then recently, yesterday, we hosted one on cybersecurity, where two of our AMA employees who work in the area gave an hour presentation. And this information, again, you can find on our website, and I'll highlight that when we. Other areas that can help you with is delivering care to patients. We offer resources to help you deliver high-quality medical care to improve the nation's health, such as population care, physician-led teams, ethics, public health, and advances in patient care. The AMA here has a very big advocacy department, both here in Chicago and as well in DC, that work directly with the government and all those different policies. Sorry. One thing and one initiative that our TCPI, Transforming Clinical Practice Initiative, CMS grant, one of the main objectives that we focus on are educational collaboratives for Queen QIOs or practice transformation networks. And the AMA is able to develop and deliver a customized curriculum based on a breadth of available resources. As Renee mentioned, by going into Step 4, you can use the practice assessment tool that helps you determine where are those key gaps and areas within your practice that you guys would need to focus on. And we also utilize that practice assessment tool or score utilizing the Step 4 modules. And just kind of a quick overview, the process is you assess the needs, we work together to determine the gaps, as I mentioned, plan and create a customized educational curriculum, and then help you in your practice to deliver the best training, whether that be webinars, whether it's on a monthly basis, whether it's more one-on-one coaching. And then we like to monitor and review the results over a process, whether it's 60 to 90 days. Last thing I'm going to touch on, another kind of aspect of our TCPI grant, recently we've launched with Share, Listen, Speak, Learn Engagement Series, a webinar series, which we are abbreviating, because everyone loves abbreviations, SL2. Our SL2 series spreads practice improvement strategies and other important topics for physicians and their practice to the wider AMA audience via a variety of channels. Share, Listen, Speak, Learn is the breakdown of SL2. We like to share the resources that the AMA has on the certain topic. You attend a live event, which is the listen piece. And Speak, we here at the AMA, we have online digital communities where the experts from the presentation can answer any of those burning questions that you have, or you like to see where your peers may have had help in the area. And then the last piece, the Learn piece, we like to connect to our AMA Education Center, where we could have further educational CME opportunities, whether for online learning. And I am going to close there, but kind of some of the things that are coming up for the SL2 series. Again, we had our cybersecurity presentation yesterday here during the lunch hour, and they're always the second or third Wednesday of the month. It's a monthly series. Next month, our topic is quality improvement and how you can developing a quality improvement culture within the practice. In March, we're looking to do a presentation around community-based resources on a diabetes prevention program in conjunction with the YUSA. I'm going to stop here, and we can have questions on the entire presentation.
Or if you have any questions, maybe something we didn't cover, resources that you were hoping the AMA might have, we can see if we can direct you to the right place.
Renee, this is Patty, and I see that, you know, we're only 25 minutes in.
Right.
I'm just wondering if, would you be able to at all go into like a steps forward category? And,
Sure, that's what
and
actually I was
maybe-
thinking about. How do we link this to going online so that it presents?
Emily, are we able to do that?
Can everyone see the screen?
No, you
Yes.
can't. Okay.
Renee, maybe if you can expand the screen to make it a little bit larger, that might help.
I think this is as large as it might go. Is it looking small for you guys?
Not incredibly small.
Okay. I'm sorry. We're operating off my laptop, and so that's just as big as it can go. So I'll walk through the Steps Forward modules. Patty, is there one that you wanted to see, or?
I was thinking like maybe just going into patient care just to see, you know, what's all in there.
How it all works exactly. So if we open up patient care, you'll see on the left-hand side that if you're in patient care and you decide that, no, I want to be in a different category, you know, all the categories are here, or you can go right up to the top, and that will show you every single module that we have. But for example, since we're in patient care, we've got team-based immunizations, using pharmacists in your practice, managing type 2 diabetes, advancing choosing wisely, listening with empathy, implementing a point-of-care registry, implementing health coaching, and planning for end-of-life decisions with your patients. So those are all of the, I think that's all of the modules that we have here. Oh no, I've got a couple more. Preparing your practice for value-based care, using the SafeMed model to improve transitions of care, behavioral health integration, and building an intensive primary care practice, improving blood pressure control. So you can see that there's, you know, a large number of different modules just within patient care. For example, we can go to team-based immunizations. All you have to do is click right on that, and you'll be taken to the main screen for this particular module. You can see, as I mentioned before, there's a number of videos available on over 20 of the modules have videos, and so you can click on that and watch, you know, an interview with a practice or with a patient. And if you keep on scrolling down, you'll see over to the right, you can also download this entire module, all the content, as a nice PDF that downloads right to your computer. You can download the PowerPoint as well, but quite honestly, I find that downloading the PDF, especially if you're the type of person who likes to read on paper, works really well, and it's got all the content that you have. If we keep scrolling down, we're going to get into the content. So you can see, even just after the introduction, you'll see these questions slide in on the bottom of the screen. Those are the questions, and if we want to see here, for example, the answer to how big of a problem are vaccine-preventable diseases in adults, if you just click on that, and then you'll get your answer. And, you know, so for example, which vaccines are routinely recommended for adults? You can see all the answers to that here. So, but here are the actual steps that you would take, and that the module guides you through. You know, getting your team on board, for example, here is the first one. You can download a tool here where your practice can customize that to your practice, and but this form is going to show you and give language on, you know, defining the vaccine for your patients. And again, here are some more questions and answers. How can I engage my team members? It's going to give information and tips on how to do any of these things that are throughout the steps portion. We have, you know, training your team. You can download this training program. Here, it's actually a number of different sessions that you can take, and all the speaker's notes that you can read for that as well. And if you just keep scrolling, you're going to see all the different steps, and then questions and answers after every step. I know that with immunizations, sometimes around, whether or not people should get their immunization, and this gives some things that you can say to patients if they decline, for example, the flu shot, or any of the other immunizations. There's a lot of information that we have here that you can certainly start using right away in your practice. And as we move along, so you can see that there's all sorts of different links out of the AMA website to, like, for example, right here, one of the CDC schedules. There's a lot of information that we link out to that you can access really easily. If we keep going all the way down to the bottom, we're going to see, again, we'll finish with the questions and answers, a couple tips that we call AMA Pearls, the conclusion, and then all the way down at the bottom is where you're going to see if you want to claim CME credits for completing this module. The CME questions, there's 4 or 5 questions depending on the module, and you have unlimited time to take the quiz if you're not getting the answers correct, but and then you automatically get the credit for it. Over here, where it says steps in practice, this is where you're going to see some of the case studies. And those, in this one, only has 1 case study. Some of them have up to 10. So it really depends on what module that you're in. And then if on downloadable tools, you can download the entire toolkit, which will have all of the forms, cheat sheets, checklists, any of the things that were mentioned throughout the module itself. So you can download all of those together as a zip file, or you can download them individually one by one, depending on, say you want an administration log, but you don't want the decline form. You can just download that, and that goes straight to your computer. And so really that's the setup for most of the modules. They all kind of follow that same format. If we go back to the beginning, we can see this is how, I'm going to go down. This is how you would access the assessment tool. Like I mentioned sort of at the beginning. Again, this it's 12 questions. It only takes a few minutes. And after you finish it, it gives you a list of modules that we've determined would be good based on your answers. And then, like I said, that just takes a couple minutes to do. And it will ask you specific questions about you and your practice, what you think your strengths are, and like I said, then it gives you the list of modules that it thinks will be good for you. I did mention the burnout survey. That can be found under professional well-being, and then scrolling down to this preventing physician burnout module. And then if we scroll down a little bit here, we will get to the survey. So if you'd like to take the burnout survey, you just start here. And again, this is really quick. I think this one's it's fewer questions, just 10 questions about your job satisfaction. And it will give you your results as well as putting you into context for other people, in similar positions to you. Do we have any questions about that, or?
Renee, there was a question on chat.
So we're going to go back to the chat?
There's a person that asked if Steps Forward is only for providers, or can other team members participate in the education?
Absolutely.
Okay, good.
Yeah. So, and I can elaborate on that a little bit as well. So the providers can certainly use these modules, but often we see that the practice managers or other people in the care team are actually going to be the ones who would actually be doing the implementation work. And so these modules are free for you to use, and every resource that's within Steps Forward is free for you to use. As far as the additional education going forward, getting help with implementation within your practice, that does not have to be done at the physician level, and in fact rarely is. It's usually somebody else on the care team, whether that's the practice manager or a nurse manager, or anyone else who's kind of taking on that role.
Thank you. I thought it was a really, pretty painless way for a physician to get some CME credits if they so chose.
Mm-hmm.
And so, yeah, thank you so much.
Yeah.
And I did. Oh, go ahead.
No, go ahead. Go ahead.
The Steps Forward program is in the MIPS improvement activity category, and so it can be used to report for MIPS. And I was on a call with CMS, and I asked if there were a certain number of modules you had to complete in there, because it just states that completion of the Steps Forward program, and there was no specific number of modules that they could say that you had to complete. Yeah.
I haven't heard of a minimum number of required modules for that. So I think as long as you do at least one of the modules and implement that in your practice, then it would count towards your MIPS activity.
Mm-hmm. Yep.
And so with that, like I said, we are absolutely here to help with implementing any of those interventions that you see on the module. And so I see another question: is the Steps in Practice section the good place to see how others have implemented? And that is correct. So that's where you're going to see all of the case studies. If we can bring that back up again, you'll see it. But we call it Steps in Practice, and that's really where you'll see your case studies. Just click on any of those, and we'll go back to a different one. And you can pick any of them, fine. And then if we scroll down,
We're not seeing your
Yep, just 1 second. We're sharing it right now.
Okay, thanks.
There we go. So then if we're within one of the modules now, and we click on over to Steps in Practice, then we'll see, what different practices have done. So again, we seem to be clicking on ones that only have one in there, but I know others have, there we go. So you can see we've got them all over the country. Some of them it's anywhere from a very small independent practice to, a large academic medical center implementing it. So some of them may be a little bit different than your environment, but, we all have hurdles when we're trying to implement any new changes to the practice or your workflow. And so even if you're not at, a large academic medical center and you're at a smaller practice, they still can, I think, bring a lot of value to you, even just reading about them. Does anybody have any other questions? Let's see on the chat.
If anybody has any questions for the phone line, Carrie, can you remind them how to get into queue?
Yes. To unmute yourself, you can press *6 and ask a question, or I can switch the entire conversation to conversation mode, and individuals can just ask their questions. What's your preference, Patty?
Yeah, maybe just switch to
I'll switch to conversation mode so you're able to
Okay.
ask a question. If it gets a little, if we get too much feedback and background noise, we'll go about it a different way. Hold on one second. All right,
One
now
thing
everyone's line has been unmuted, so feel free to ask questions if you have them.
Okay, great.
Has anyone used Step Forward before? Or been to the website at all? I'll take that as a
Yesterday,
no.
I was, or they can, if you don't want to talk, just chat in your answer, yes or no. But yesterday I was on a call and they were talking about the Choosing Wisely program. Oh, I saw you just had it up there.
We did just have it up there.
Yeah, and reference was made to if a practice didn't want to fully implement the Choosing Wisely program, that Steps Forward is a good place to start. So I thought that was a good.
Oh, and they referenced that on another call?
Yeah.
Right. Yeah. And really, the Steps Forward really makes things that seem very daunting or difficult to implement. It really breaks it down into just a few steps so that you can implement these, with as little frustration as possible within your practice.
Mhm.
And like I said before when I was giving my main presentation, the team-based care is something that's really popular. And if you look at just the team-based care module, it's going to recommend a number of different modules beneath it, like expanded rooming and discharging protocols, pre-visit planning, pre-visit labs, a pre-registration process. There's so many pieces that make up team-based care that sometimes when people throw that word around, it seems a little overwhelming, like you can't do all of those things. And that's why we've broken it down into some of the core pieces of team-based care, so that way it makes it, easier to implement if you just pick one small one at a time.
Yep. So a lot of times when I tell the practices that I'm working with, it's the elephant bite at a time, because otherwise
Say
it
that again?
gets too big. If you just eat the elephant one bite at a time.
That's right. That's right. So does anyone on the line have any other questions or what they want to see? Go back to the chat. Yeah, so that's right. Thank you. Hopefully, it's definitely beneficial for your CMEs. They're really easy to take here, and it also, our education center will record that you've completed the CME, and you can always go back to it and print out, the record of your CME passing the quiz. And if you took one, let's say tomorrow, and then 3 months from now you take another one, that's stored in there for you if you create a profile. Do nurses earn CEUs as well? That is a very good question.
I don't think Step Forward currently provides CEUs. I do know that if you don't utilize the CME portion of it, you can get a certificate of completion, which I'm not quite sure if you have to check with your association,
With your state.
or your society, but you may be able to check that box for CEUs by providing that certificate. But currently, Step Forward does not offer CEUs.
Mm-hmm.
Yeah, sure. So we are, one of the things I didn't touch on is what is coming up for Step Forward. Within, what are we looking at for the launch date? Probably in the summer, we're going to be launching
4 more modules. I can tell you what they are. One is about how to, we have it right here. One is about the social determinants of health. Another is about panel size management, and that's how to determine what your panel size should be and the things you can do to calculate that, as well as risk assessment for your patient population. One on EHR use and making that more efficient. EHR is everyone's favorite topic. So we are coming up with some ways to make it a little bit more efficient for you and your practice. And then one on opioids. So that's obviously a hot topic everywhere in the country. And so those 4 are coming up for the summer. We're finishing those up this week, next week. So those are coming up. We usually introduce new modules a few times a year, and we do it like this. We're introducing 4 or 5 new ones at the same time. We do that typically about twice a year. So there's always new content. If 50 modules was not enough, there's always more coming.
Great. Well, we have 15 minutes. If you have any questions, please speak up or put it in the chat. You might want to mute somebody's line.
Yeah, maybe.
Carrie, I'm wondering if we can just mute everybody's line and then have them dial *6 if they have a question. There's some background noise.
I can sure do that. Okay, so I'm going to switch us back to presentation mode. If you do want to ask a question, you can press *6 to unmute yourself.
Thank you.
Well, we still have some people on the call, so I guess maybe I'll pose a question to you. Are you working on, people listening on the call, are you working on any implementing interventions in your practice? Have you tried doing any kind of smaller interventions around your workflow or on any of your care delivery? Does anyone want to talk about that? Well, Patty, what are some of the interventions you've been working on with some of your practices?
Some of the things that we've been doing is we've encouraged practices to implement blood pressure protocols. Mm-hmm. And, of course, my main focus is the MIPS program and, the EHR use, mm-hmm. basically optimization of EHR. But I know that there's some colleagues of mine on the phone. Lisa Thorpe, I saw her, and I know Jamie Stagg, who is monitoring chat, he's doing, some things around opioids. So if any of you want to just kind of share what you're doing, and Natasha. Oh, we do have somebody in chat that are working. They're working towards PCMH, and they're working on team-based care, pre-visit planning. So, wow, you're doing a lot.
Great.
Hypertension, population health management, awesome.
Great. So, Susan, it looks like you could probably benefit from some of the modules here, specifically around team-based care and pre-visit planning. We have modules on both of those. And a lot of different tools that you can use.
I think we need to be in Q&A mode for the unmuting to work.
Oh, gosh, I'm sorry. I'm going to switch it now and see if that helps. I apologize. Hold on. Okay, I switched it to question and answer mode. So now if you have a question or a comment, you can press *6, and hopefully that will allow you to speak. and be heard.
This is Natasha. I was going to comment. I think I've used in the past, not necessarily just the modules, but a lot of the resources from this site based on specific projects. And I think this will be a great resource. I noticed someone put PCMH. I think that's a great resource for any hospitals or clinics looking to get their PCMH accreditation. So it's a great resource, and I've shared it with some of my coworkers as well.
Great. And it's true. I mean, a lot of the pieces from team-based care will definitely help on your path towards PCMH.
Hi, this is Lisa, and I am assessing, where our practices are at with their hypertension protocols, and so this would be a great resource for some of them as well. I also do diabetes work, and I will have a look at those diabetes modules too.
Great.
Everybody always is looking for resources on, every community, every facility seems to be a little bit different, so
Sure.
it's just good to share the ideas.
Yeah, and like I said, when you go to the downloadable tools section in any module, they are there to download, and we have on purpose made them. They're typically Word files, so you can customize them depending on what's happening in your practice and what works best for you. All of that is available to do like in a Word format.
That's good to know because a lot of them, have somewhat of a protocol in place, but some of these might give them a few more
Exactly.
tips
Yep.
to tweak their protocol a little better.
Exactly. And if that way, you also don't have to recreate the whole. You don't have to recreate a whole checklist or any of the other pieces to it. They're all available for you right there.
Right. I like that. That looks good.
I will say I do know that our one of our blood pressure modules has not been updated with the new guidelines yet, but that will be updated with our summer our summer launch. That one is on track to be redone, updated. So any other questions or thoughts or anything else? So earlier in the chat, go ahead.
Oh, nothing. I was just going to say I don't see anything in chat, anything further, but go ahead.
No, I was just going to say earlier in the chat I did put mine and Ashley's emails if you would like to contact us about any of the modules or the resources that the AMA offers. In addition, if you forget that, we've got in the modules an area where you can email us about the module, and then that will go right to us. So I think that's about it then, Patty. Thank you again so much for inviting us to speak with your practices today. I appreciate it. Right, so they're now down at the bottom. There we go. Thank you, Jamie, for doing that. And if there's not anything else, then I guess we'll end here.
Yeah, thanks again, and thank you to everybody on the phone that participated today. I hope you found this information valuable and, applicable to the things that you're doing in your practice. And so please take a moment to offer feedback on this WebEx. That helps us to make sure that we, are meeting your needs and educational offerings, and we really do value that feedback and input. And Renee and Ashley, thanks again so much for, just your time today and explaining the things the great resources that you have out there, and I'm sure that they they're very useful. I just hope that people will go out there now and download those things and use them. And so just a last thing is we do invite you to visit our Great Plains website at the link that's shown on the screen right there. And we do have resources there as well. And also, if you are interested or have any of your colleagues that might be interested in joining our Learning in Action Network, please do that, and you'll be notified of any further educational sessions that we do have. And I think I did put the Steps Forward link on our website as well, so that's out there. So if there are not any more questions, we will let you have 5 more minutes in your day. And thanks so much again, and we will talk to you later.
Great, thank you.
Thank you, everyone.
All right, bye-bye.
Thank you.